Right then, let's talk about something that's been quietly bothering millions of people across Britain. We've got the NHS, the National Health Service, free at the point of use, something this nation has been proud of for over 75 years. So here's the question: why are more and more British people, especially those in their 60s and 70s, now reaching into their own pockets and paying for private healthcare? Something's gone wrong. And today, we're going to find out exactly what. Part 1. The NHS we all know. Now don't get me wrong, the NHS is remarkable. Truly, you fall ill, you ring your GP, you get seen, you get treated, and you don't pay a penny. That's the dream, isn't it? But here's the reality for many older people today. You ring your GP and you wait. You need a specialist. You wait longer. You need surgery. Well, you could be waiting the better part of a year, sometimes longer. And when you're 68 years old with a dodgy hip or a heart that's playing up, waiting simply isn't an option. Part 2. The numbers are alarming. Let's look at the facts, shall we? Right now in 2026, there are 13.6 million people in the UK aged 65 and over. By 2040, that's just 14 years away, that number is expected to climb to 16.8 million. That's nearly 3 million more elderly people needing care, needing hospital beds, needing doctors. And the NHS, it's already stretched to its absolute limit. Care homes across Britain are running at 88 to 90% occupancy, nearly full. There's barely room to breathe, so what do people do? They pay privately. Part 3. The postcode lottery. Now here's something that really gets people's backs up. If you live in a wealthy part of the country, say parts of Surrey or Cheshire or Edinburgh, you'll find no shortage of lovely private care options, beautiful facilities, attentive staff, quick appointments. But if you're an ordinary working person, middle income, worked hard all your life, paid your taxes, the affordable options are few and far between. The system, quite frankly, has left the middle ground behind, and that, as many British families are now finding out, is a very uncomfortable place to be. Part 4. Why are people choosing private? So let's be straight about why people are making this choice. Number 1. Waiting times. On the NHS, some patients are waiting 18 months or more for routine procedures. Privately, you could be seen within the week. Number 2. Peace of mind. Especially for older folk, knowing you'll be seen quickly, treated with dignity, in a clean and comfortable environment, that matters enormously. Number 3, and this is the one nobody talks about, fear. Fear that if something serious happens, the NHS simply won't be there fast enough. That fear, rightly or wrongly, is driving people to spend money they hadn't planned to spend. Part 5. What can you actually do? Now, I'm not here to tell you the NHS is failing, because it isn't. The staff are extraordinary, the dedication is real, but I am here to tell you, if you're in your 50s or 60s, it's worth having a proper think about your options. Private health insurance, taken out early, can be surprisingly affordable. Some plans start at just a few pounds a day. It's also worth speaking to your local GP about what you're entitled to. Many people don't claim everything they're owed. And if you're caring for an elderly parent or relative, get informed now, before a crisis hits, because in this climate, being prepared is everything. Britain built the NHS as a promise that no one would suffer because they couldn't afford care. That promise hasn't been broken, but it is under enormous pressure. And until the system catches up with the reality of an aging nation, more and more families will quietly, sadly, be reaching for their wallets. If you found this useful, do give it a like and subscribe, because we cover exactly these kinds of issues every week. Things that matter, things that affect real lives. Take care of yourselves and each other.